Welcome to QD Clinic. QD Clinic is brought to you by Room Now Live, where you go from so what to now what, meaning we're about building confidence and certainty. There'll be a lot of certainty thrown around at Room Now Live in a few weeks. I'm Jack Cushwood, Room Now. Today's case is a discussion of the patient phone call to discuss the labs. You must get that. I get it all the time. I don't really want to call patients about every lab that I get done. I know if you're a patient and you had labs done, you want someone to explain this to you. Well, there are a lot of ways of handling this. This is my way of handling this. I want my patients to see their labs. I want them to collect their labs, keep them in a folder, bring them to the visits, and we discuss them at visits. If I have the opportunity, I like to look at the labs, stamp them with a stamp that says, okie dokie, all within normal limits, nothing here to worry about, even if there is something out of range. We can discuss at your next visit. Or the stamp says, there's a concern here, concerned about your rising AST, that's a liver enzyme, we need to discuss that at next visit, nothing urgent. Obviously things that are urgent, we're going to call the patient and say, urgent, come in, we got to do something. But I don't like having to call about every lab. Since I draw a lab on everyone, I can't be calling everyone back about a lab, so I need a method of communication. You got to realize that there's a big problem here. And this was really I think, hit home for me when I was at an advisory board meeting, gosh, this is about 7 or 8 years ago. And a colleague of mine, in discussing the importance of labs, she said that patients believe their labs more than they believe their doctors. And I thought, oh my God, is that not true or what? I wrote a blog about it. It's called Patients Believe Their Lab Tests More Than Doctors. You can look it up. I'll put it in the show notes. I think this really gets to the problem. And the problem is that patient may know you, patient may usually doesn't know you when they're asking for the results of the labs. They've seen a lot of doctors. They're not always accurate. They want me to do things I don't want to do. I don't know why. I want them to do labs just to see how I am, and then they don't want to call me back about the labs. Well, in their mind, some of what you do is subjective. In their mind, labs are objective. You got to believe numbers don't lie. They believe that the labs are a numeric representation of their wellness and the true arbiter of their health or not. God forbid you order a CBC, a CMP, sed-rate CRP, rheumatoid factor, and of the 47 lines on the 3 pages of labs, 3 of them are out of range. Patients are wigging out over this. And you know that this is not necessarily important. The more lines there are on the page, the more tests that are actually run, the more you increase the odds of a random out-of-range result. Because the range is mainly, who's in the middle of the bell curve, not necessarily an indication of disease state. A low chloride or a high chloride by 3 points is not going to make or break the clinical situation here, but yet sometimes we have to explain that to patients. It's important. We do have to explain it, but you set up the rules. So you have to sort of dispel this notion that labs are gigantically important. You got to state that labs are being done for your safety and for me to confirm a diagnosis I'm already expecting. If you're doing diagnostic fishing by ordering a large battery of lab tests, you're wasting time and money. Because now you're going to spend a whole lot of time explaining labs that you should never have ordered in the first place. So labs are free. Labs are numeric. And when something's out of range, how do you explain it? I often explain it by using the speedometer, meaning I don't worry about that AST of 47 because it's a little bit like getting a ticket of doing 57 in a 55. You weren't really speeding. It was just out of range for that moment or two. And that's all it really means, and we don't have to worry about that. You can use this on titers of 1 to 40, 1 to 80 ANAs, almost always meaningless. 20 million Americans have titers that are in that range. Same thing for marginally elevated rheumatoid factor, or maybe even sed-rate or CRP that are just over the edge of being normal. If normal is 20 on a sed rate and it comes back at 25, Not much I'm going to do about that, to be honest with you. Now, if it comes back at 85, I've got to explain it, especially if it comes back more than once. So I don't usually repeat labs. I almost never repeat labs unless they indicate something really wrong is going on and I'm trying to treat that, which is really wrong. I think one of the problems is that doctors are to blame for the importance of labs. Why? Well, you often say things like, let's look at the labs before I answer your questions about what you have. When the labs come back, I think we'll know what to do next. Mr. Sample, seems to be a problem with your labs, meaning a problem with you, Mr. Sample. This is a bit of a problem. So on one hand, you say, you, Dr. Jekyll, says the labs don't mean so much. And then there's Dr. Hyde who say labs mean everything. You wonder why patients sometimes don't necessarily follow what we say or are worried about what we say. So tell them a lab abnormality is not a diagnosis. It's a lab abnormality. I can explain it, but not all of them really need to be explained. Tell them when you're ordering a CBC and a CMP chem profile, I want to look at the creatinine, I want to look at the AST and the ALT, the white count, the hemoglobin, hematocrit, and platelet count, and other than that, I don't care about the other 14 to 28 lines. When one of those 5 or 6 things are abnormal, then I use the other things to make up the story and to understand what's going on. And if you explain it that way, maybe they start to understand why there's so much that comes back when they look at their own labs. Make clear that the fact that you're using labs to look at drug safety and that there's nothing to worry about. Make clear the fact that I'm doing this specific lab test because I want to decide whether this is gout or reactive arthritis, and this lab test will tell me the difference between the two. Order the test once, don't keep repeating it. I don't know why some people keep getting ANAs and rheumatoid factors on people who have negative ANA and negative rheumatoid factor once and they still have joint pain. It's not like it's going to magically become positive. And if it does, it's going to be 1 out of 6 times, and it's going to be over the range, into the abnormal range, and it means nothing. So again, constant discussion about the importance of labs, because you make them important, is necessary at each visit. If you do it at each visit, you won't have to do it on the phone or by text messaging or by the portal in between visits. If that's what you choose to do, good luck with that. I like to, again, tell our patients, keep your own folder of your labs and important tests. You'll need them when going forward to see other doctors in the future. Hope you find this helpful. Tune in for more QD Clinics.